Hi, everyone. Thank you for being here at Small Always Dental. We evaluate sleep and breathing wellness to recognize and help individuals of all age groups. Obstructive sleep apnea is a medical condition with oral manifestation. During your dental examination visit with Dr. Jyoti, she has seen signs in your mouth which she is concerned about. This could also be loved ones or someone you know. There are a broad spectrum of medical conditions resulting from this. By the end of this presentation, our goal is for you to understand all of these things that seem very different may have a common root cause. So there is a silent crisis going on in America. ADHD, snoring, allergies, crowded teeth, swollen tonsils, daytime drowsiness, anxiety, depression, obesity, bruxism, cardiovascular disease, cancer, and more. In children, bedwetting difficulty. And then the research has shown that 9 out of 10 in America suffer from one or more of these conditions. We are seeing a rise in all of these symptoms all around America. Am I healthy? As we go through this presentation, we will start with our focus on children. This might have been you as a kid, so let's get started. I have Michael on the left, looks a little more overweight than he actually is. His jaw is sitting behind the line. We want it more front. This is an underdeveloped jaw. The girl in the middle has dark circles under her eyes, dry lips, and a stressed chin. The kid on the right has a double chin, facial astrometry. Compare the eyes and shoulders. Am I healthy? The girl on the left has a cervical tilt. Kiddo in the middle is not able to close her mouth. Girl on the right looks super tired and unrested. This is what a lot of our children look like these days. In fact, this has almost become what normal looks like. We are seeing so many children who look like this. We are seeing these visible signs. We are seeing signs of ADHD, depression, snoring, dark circles, allergies, and more. These are typical signs and symptoms of one possible cause of compromised airways. The true question is, why are we seeing these underdevelopment? So many people impacted with this, and what could be causing the compromised airway? Let's find out. Where did this come from? Why are we seeing so many children who have really crowded and crooked teeth? Why do 80% of our children need orthodontics? Earlier, this was the ideal alignment in children. We want to see the even spacing between the teeth so the permanent teeth actually have room to come in for kids and nice widely shaped palate. But right now, they are considered endangered species. We are rarely seeing this. Large teeth. One of the preconceptions we have been told, our teeth are too large for our mouth, and we have to have them removed, but there is no true medical necessity for those extractions. So what's happened? Normal craniofacial growth. This is a great illustration for the ideal craniofacial growth. The inner line shows 55% of the growth is completed when we are 2 years old. The outer line shows 90 to 95% of the growth is completed by the time we are 12 years old. Ideal growth is wider forward and downward. Take note that majority of our growth happen in the middle thirds. Why are so many children suffering from abnormal growth and development? The question we should be asking is, why are we not seeing this today? Now we have some research by Dr. Corricini. He was an anthropologist, wanted to know why. Why are we not seeing that ideal growth anymore? What he ended up doing is he studied 100 skulls more than 400 years ago, and he found great things consistent among these skulls. So what he found was these skulls had bigger upper and lower jaws, and there was room for all 32 of the teeth. There was very little incidence of crowded or crooked teeth and had no need for braces. They had no signs of periodontal disease. In present time, very few people have their wisdom teeth, and most don't even have room for all their teeth without being crowded and crooked. So, population studies by Dr. Corricini. He also studied isolated rural populations, groups of people who were not exposed to Western culture habits like processed foods and formula. What he found was these populations, they breastfed their children for many years, 2 to 3 even. And they ate a diet compressed of hard, tough foods, dried meat, and hard root vegetables. He found the same exact 3 things. They all had 32 teeth, no gum disease, and no need for braces. His conclusion of his study was that soft food diet does not stimulate proper growth, leading to underdevelopment of upper and lower jaw, ultimately leading to crowding of the teeth and malocclusion. Dr. Corricini had another study. He studied a population over time as Western culture was slowly introduced. He started seeing dramatic increase in the rate of malocclusion. In the first generation, about 50% increase in malocclusion. In our second generation, we are up 70%. And in our third, we are at 85%. What's interesting is we are in the 4th generation today, and we are at 92%. So obviously, we need some orthodontic now. So what we know, here's really what we know about malocclusion is acquired and it's not inherited. For a genetic mutation to take place in 51% of human population, it takes 27,000 years. Dr. Corricini was able to see it in 400 years. This means that crowded and crooked teeth is not caused by genetics. It is caused by our culture changes. So what does this really mean by Western culture influence? Does it mean that Western culture is wrong, but tells me something is happening with changes in our lifestyle? What we see is limited breastfeeding and more bottle feeding. How does that impact our development? Different muscle fibers used in breastfeeding is much different. The child really has to work to get that milk. What that is doing is strengthening the muscle fibers in the face, especially the tongue, to be where it should be, and that's actually helping to promote The jaw grow downward and forward. Now with the bottle feeding, the tongue is sitting low in the mouth like a stretcher. It's not stimulating or promoting that growth. Western culture influence. This is what we feed our children, and they are not stimulating the growth with this. More soft, melt in your mouth goodness. This is what we should be feeding our children. The act of chewing raw vegetables like carrots, broccoli, jerky helps to stimulate the growth of jaw downwards and forward. So the research conclusions, this is what we know. Most malocclusions is acquired and it's not inherited, meaning it is not a genetic. We do not get our mouth form from our parents. Malocclusion is unique to Western culture, and that the presence of malocclusion is a key indicator of an underdeveloped airway. So what we know is Dr. Wallace's study concluded an early soft diet prevents the development of muscle fibers of the tongue, resulting in a weaker tongue, which cannot drive the primary dentition out into a space relationship with fully developed arches, which will lead to more crowding of our permanent teeth. So we know that having a strong, well-developed tongue is important in making sure our arches are developed correctly. The tongue is going to act like a natural retainer, and that is pretty cool. The cheeks are going to naturally follow the arch. So these are two ideal examples of the arches. Clearly, the Gothic arch is not the ideal arch where you have the overcrowding high vaulted. We have the Roman arch on the right, where you can see the tongue has actually been able to suction up to the palate. It's where it should be at. Keep that vision in mind over the next few slides. To give you a quick definition of what we mean by maxilla, it is much more than that part of the face which holds the upper teeth. It actually goes up till the nasal cavity and up till the orbit of the eyes. One researcher, Dr. Christian from Stanford University, and they were really the pioneers in dental sleep medicine, suggested that dental arch expansion improves breathing in patients with upper and lower jaw constrictions and can be a valid treatment. This demonstrates prehistoric jaws on the right that have enough room for all teeth. On the left is the modern arch. Green arrow is showing where the airway is and how that arch and palate is impacted. So if you have someone with that high vaulted palate and crowding, they have poor airway. This image shows us that the upper and lower jaws are a major part of our airway development. Keep in mind the roof of our mouth is the floor of our nasal cavity. So if you have a high vaulted palate, it's going to impact the airflow in your sinus. In addition, an underdeveloped upper jaw keeps the lower jaw from fully developing because the upper teeth trap the lower teeth and the jaw cannot expand forward to correct that position. When the lower jaw does not fully develop, it impacts our airway. So does that airway look like? What does that airway look like? Sorry. What does your airway look like? a narrow straw, or a big garden hose? What does your child's airway look like? Which airway would you rather have? These are a few examples of different airways. I want you to see the different colors of the airways, the orange, the red, and the yellow. We don't want to be seeing that. What does your airway look like? This is one of the screenings tools that Dr. Choti will use. We will take actual scan and show you what it looks like. Do you have a nice garden hose or a small coffee straw? That makes a big difference on how it impacts your overall health.
Just a few hundred years ago, the human face was different. It was forward grown.
I want to share with you a 3-minute video. It really wraps up the first half of this presentation very well.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, most of
that was a great video. Next, I will be showing you a video of baby Eli. His mom's a nurse, she's in the back seat, and it can be a little bit hard to watch. And if you haven't seen anyone experience sleep apneic events, this is what it looks like. It's a 30-second video. All right, so what does that really tell us? It's the development of the upper and lower arch, which has a huge impact on how we breathe. For baby Eli, the jaw hasn't really developed forwards and downwards like the ideal growth. So when his mom pulls the jaw forward, it allows airway to open and establish nasal breathing. And I am going to take you to the next part of the presentation, which has a huge difference in terms of mouth breathing and nose breathing. What happens when the upper jaw is underdeveloped and a person is not able to breathe through the nose and instead breathes through the mouth. When we breathe through your nose, the air is warmed, filtered, and humidified. In addition, nitric oxide is produced in your sinuses. Nitric oxide is a vasodilator, which helps our bodies absorb oxygen. When you breathe through your mouth, this doesn't happen. Unfiltered, dry air is hitting your tonsils, and you end up with inflamed tonsils, which further impact your ability to breathe. When you breathe through your mouth, the oxygen is not mixed with nitric oxide, so your body does not absorb the oxygen as efficiently. Nasal breathing is very important for our bodies and our health. So research by Dr. Harbold wanted to know what happens when you become a full mouth breather. He conducted airway studies on rhesus monkeys where they had become mouth breathers because he stuffed their nose with cotton rolls. As a result of mouth breathing, they had low tongue position, causing malocclusion. What is interesting about this, we see exactly the same signs that I am going to share with you in adults and kids that are also mouth breathers. This particular monkey, as a result of mouth breathing, developed that we call a long face syndrome. Let's take a step back during this presentation and go ahead and take a deep breath through your nose and see where your tongue is. It is up and forward. And now take a deep breath through your mouth. Your tongue is sitting low. So what's interesting is by the end of this study, cotton rolls were removed and the monkey was able to reestablish the airway, the long face syndrome corrected. So the monkey obviously had a happy ending. Here's what we know. When you have a compromised nasal airway and you breathe through your mouth, it leads to low tongue posture. It also causes tonsils and adenoids to swell. So research by Dr. Aronson did studies on children who were already mouth breathers versus children who were nasal breathers. He found that nasal obstruction leads to mouth breathing, which leads to low tongue posture and high rates of malocclusion. So it is really important that we get people breathing through their noses. Kind of where we start treatment for our kids and adults is training that tongue to be up and in the palate, establishing nasal breathing. Those are a couple of our factors we really want to begin with treatment. You may also be wondering what's the connection between ADHD and ADD, airway, and sleep. I'm going to share another video with you. It is by Dr. Ben Moralia, and he has been practicing for over 14 years in New York, but he has a lot of studies with that connection. So let's go ahead and play the video.
Take a child, alter their quality of breathing asleep. And the real big issue now is how will we be during the day? So that if the child stops,
All right. So like the doctor said, Dr. Karen Bonu studied 11,000 children over 6 years. And what she found is that there was a strong and persistent association between sleep disorder breathing and diminished IQ. She also found that sleep disorder breathing increases the risk of being diagnosed with ADD, ADHD by 50%. So now you may be asking, how is this all connected to bedwetting? So Dr. Mary Mirage Leah is going to explain the connection between bedwetting, airway, and sleep.
The other thing that might happen is bedwetting. Bedwetting is a little more common than people are aware because it's also a best kept secret. Not many people are running around with advertising that controls bedwetting under natural laws. It's noise control. But bedwetting does have a relationship to how we breathe and our quality of sleep. And some of the causes of bedwetting is the way our sleep. Let's try this.
So as an essential role of dentistry, wanted to share a few kids' cases. Then I will jump right into the adult portion of it. This video was made by Connor Deegan's mom. He was not treated with Vivos appliances, but it is a very powerful video on how airway and sleep impact children. Okay, so you're probably wondering on how can the dentist help? This is Hunter. Hunter struggled with bedwetting. When we look at his teeth, he has a deep bite and no room for his permanent teeth to come in. Now we know that this is a sign of underdeveloped upper and lower jaws. This is what he looked like after 10 months in treatment. And he stopped wetting the bed after just 1 week in treatment. Why? Because he was able to breathe better and sleep better. We don't know about Hunter when we entered treatment that he was a chronic bedwetter. And you know how it affects his life. Summer camps, sleepovers, mom is waking up in the middle of the night and freaking out, and the husband is waking up. They have all these factors, but one beautiful part is the one appliance stopped bedwetting. Orthodontically, Hunter has great results. He has substantially space for these teeth to come in. Show the buccally place right here. Okay. So next we have Paige. Paige also had a deep bite and a lot of crowding. This is what Paige looked like after treatment. Look at the beautiful development of her upper and lower jaws. I also want to introduce you to his sister Paige. This for her was mainly for braces. Her parents didn't want to put her on braces, and this was a nice alternative to it. And it's just an appliance the kid can wear at night. That's in less than 10 minutes. Remember Michael? This is Michael at the age of 9. Then at 14, after he had treatment. Michael, you might recognize him from the beginning of this presentation. The jaw was able to come down, wide, and forward. Look at the differences in Michael's teeth. But better than that, look at the changes in Michael's airway. Now we will take a little bit closer look. This was his before and this is his after. Even closer look. Focus is at his airway, the curvature of his spine. Notice where the jaw is sitting at in both, where some of his jaw is really sitting. If you're now wondering, what about my kids? Or what about my spouse? You go through struggling, hear them snore, you can punch your partner in the middle of the night, and you can stop laughing about it, but knowing what I know now, snoring is something greater and something more. There's something more that's going on. So not kidding. He came back with a 28 AHI after the sleep study. Now, what does that number really mean? That is apnea hypopnea index. And he was stopping breathing 28 times in an hour. Crazy. Stop. 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 Set the video.